Okay, guys, I'm live and I didn't realize that. Somehow, now I'm live. Okay. So sorry for this. So that's me, Dr. Sonal Parihar. आज पता नहीं क्या इतना लैग हो गया. It's almost 9 minutes late. Oh my god, let me just message my team that we have started. Alright, so आज हम फटाफट क्वेश्चंस करेंगे. हमारे पास एज यूजल 30 मिनट्स हैं. वी हैव 4 पीपल वॉचिंग. सो गुड मॉर्निंग एवरीवन. इवनिंग में आज की क्लास है वल्वल एंड विजाइनल कैंसर. हमने सारे कैंसर्स कवर कर लिए. ओवेरियन कैंसर, एंडोमेट्रियल कैंसर, सर्वाइकल कैंसर. आज हम अनइम्पॉर्टेंट वाले जो वल्वल एंड विजाइनल कैंसर है वो करेंगे. ठीक है. और अभी हम फटाफट MCQs करते हैं. सो दैट्स मी, डॉक्टर सोनल परिहार ऑन अनअकैडमी एंड गिविंग यू दिस क्रैश कोर्स ऑफ OBGY. क्योंकि मैंने 16 मार्च से ज्वाइन किया है तो मुझे अभी 1.5 महीना हुआ है और मुझे पता है आपके एग्जाम्स बस सिर पे आ चुके हैं. सो लेट मी हेल्प यू इन रिवाइजिंग. सो दैट्स मी. आई हैव अ चैनल आस्क योर गायनेकोलॉजिस्ट एंड आई हैव अनदर चैनल डॉक्टर सोनल्स ट्यूटोरियल्स. ठीक है. तो मेरे पास 2 खुद के पर्सनल चैनल्स हैं और इस पर मैं वीडियो डालती रहती हूँ. कभी टाइम मिले, आपको लगे कोई टॉपिक अच्छे से समझना है तो इसमें हम 10-10 मिनट के टॉपिक्स बनाते हैं. ठीक है. सो आई एम एन एंडोस्कोपिक सर्जन इन जोधपुर. आई हैव माई ओन हॉस्पिटल. देन प्लस सब्सक्रिप्शन मैं सब हमेशा बताती हूँ. प्लस इज़ बेसिकली अनअकैडमी. अनअकैडमी के सारे ट्यूटर्स आपको, अगर आप नीट PG की तैयारी करें, ऑल द 19 ट्यूटर्स का PDF, उनके नोट्स, उनके रिकॉर्डेड लेक्चर्स, उनके लाइव लेक्चर्स, ग्रैंड टेस्ट, एवरीथिंग आपको मिलेगा. आइकॉनिक इज़ क्वाइट फेमस बिकॉज इसमें प्रेप लैडर और अनअकैडमी दोनों ने हैंड्स ज्वाइन करके आपको यहाँ से PDF नोट्स एंड रिकॉर्डेड क्लासेस और यहाँ से सारी लाइव क्लासेस एंड MCQs दोनों के एंड ग्रैंड टेस्ट वगैरह. तो अभी आपको कुछ भी खरीदना है तो आपको बस मेरा कोड डालना है. वेयर इज़ अ कर्सर. माई कोड इज़ डॉक्टर सोनल. प्लस के लिए भी, आइकॉनिक के लिए भी ये कोड हमेशा चलेगा. इसमें आपको 10% डिस्काउंट मिलेगा. अभी बीच में 20% डिस्काउंट का ऑफर आया था, वो खत्म हो गया. अभी 10% डिस्काउंट चल रहा है. सो गो एंड अवेल दिस. 2 मंथ्स, 6 मंथ्स, जितनी भी आपको चाहिए. जैसे प्लस में देखो 2, 6, 9, 12 इतनी बड़ी बड़ी सब्सक्रिप्शन है. मैक्सिमम 4 ईयर्स. आइकॉनिक स्टार्ट होता है 6 मंथ से और जाता है 4 ईयर्स तक. अब ये जो आप रेट्स देख रहे हैं 20% डिस्काउंट वाला है, ये अब ओवर हो चुका है. अब चलेगा 10%. ठीक है. तो 10% भी इज़ अ वेरी गुड डिस्काउंट. गो एंड अवेल दिस. लाइट इज़ ओनली MCQs. ये बहुत अच्छा सब्सक्रिप्शन है. अगर आपका 15 दिन बाकी है एग्जाम में, 20 दिन बाकी है, आप सिर्फ MCQs खरीद सकते हो. बहुत सस्ता है. 1920 तो नहीं होगा, अब ये 2160 होगा इसका रेट, क्योंकि 10% डिस्काउंट पे. वैसे नॉर्मली 2400 है. और MBBS के एनाटमी, बायोकेम एंड फिजियोलॉजी यानी कि फर्स्ट ईयर जो है प्रॉफ 1, उसके लिए 3 मंथ, 6 मंथ्स एंड 12 मंथ्स के सब्सक्रिप्शन अवेलेबल है विद 10% डिस्काउंट. बैच स्नैपशॉट 20 मई तक हम आपको पढ़ाते रहेंगे. सारे एजुकेटर्स आपके साथ लगे हुए हैं. मेरी सारी अब स्पेशल क्लासेस हैं. आपके एग्जाम से पहले कोई भी प्लस क्लास नहीं है मेरी, तो कोई पेड नहीं है, सब फ्री क्लासेस हैं. ठीक है. एंड वी विल कंटिन्यूसली डू MCQs नाउ. आज मेरी लास्ट थ्योरी क्लास है इवनिंग में. ठीक है. देन नीट PG प्रीवियस 4 ईयर्स के क्वेश्चन बैंक आप खरीद सकते हैं. प्लस प्लेटफॉर्म है ये, यानी कि आपको 85 जो हेल्पलाइन नंबर उस पर कॉल करना है और ख़रीदना है. खरीदने के लिए कोड मांगेंगे, तो मेरा कोड है डॉक्टर सोनल. इसको लगाते ही आपकी फ्री क्लास तो अनलॉक हो जाएगी. पे नहीं करना है, और जो पेड है उसमें 10% डिस्काउंट मिलेगा. ठीक है. देन प्लस टेस्ट कैलेंडर, ये आज लास्ट डे है, तो आज ये वाला टेस्ट आपका सुबह हो गया होगा 10 बजे, राइट. ये चल रहा होगा अभी. एंड फ्री टेस्ट कैलेंडर के लिए भी आपको मेरा कोड यूज़ करना है डॉक्टर सोनल. फ्री टेस्ट, कोई भी चीज़ फ्री, जैसे इवनिंग की क्लासेस भी फ्री होती है, तो डॉक्टर सोनल के कोड से अनलॉक होती हैं. एंड आज बस ये वाले टेस्ट बाकी हैं 30 तारीख वाले, दैट इज़ रात के 7 बजे एंड 10 बजे. ठीक है. मिक्स्ड बैग है. और देन फिजियोलॉजी है. ना ऑटो डेली प्रैक्टिस पेपर्स, इट इज़ ओनली फॉर द प्लस प्लेटफॉर्म. जो लोग पे क्लास कर रहे हैं उनके लिए डेली पेपर्स जो है अनअकैडमी के ऐप पे ऑलरेडी एनरोल्ड है. एनरोल क्या मतलब, ऑलरेडी वहाँ पर है, तो आपको जस्ट वहाँ से डाउनलोड करना है और वहीं पर मोबाइल पे ही करना है. ठीक है. यू कैन नॉट टेक अ प्रिंट आउट, बट वहाँ पर प्रैक्टिस कर सकते हैं. ये बैच 15 मई को खत्म हो जाएगा. दिस वॉज अ मैराथन बैच फॉर 1.5 मंथ्स. सो दैट इज़ मी एंड ऑल द ट्यूटर्स हियर. वी आर हेल्पिंग यू आउट. और ये प्लस वाला था, इसका सब्सक्रिप्शन 2 महीने या 1.5 महीने का था. ठीक है. अब ये वापस नहीं बनेगा. अब इसमें आप बीच में घुस के प्लस क्लासेस जो चल रही हैं उसमें आप आ सकते हैं. जो पुराना आपका मिस हो गया वो आप ले सकते हैं. FMGE के लिए, क्योंकि एग्जाम 4 जून को है, तो ये नया बैच बना है. पहले 30 मार्च से 30 मई का 2 महीने का था. अभी 1 मंथ का 27 अप्रैल से 27 मई तक का है. एंड ऑल यू ट्यूटर्स आर हियर. देन दीज आर ऑल द न्यू ऑफरिंग्स. प्रॉफ 1 मैंने बता दिया. स्पेशल क्लास आज इवनिंग में बस एक क्लास है 7 बजे, जिसमें कि इंटरैक्टिव क्लास है. यू कैन रेज योर हैंड टू टॉक टू मी एंड यू कैन आस्क अ क्वेश्चन. ठीक है. सो वी विल क्विकली स्किप दिस बिकॉज वी आर ऑन क्वेश्चन नंबर 43 या 44 पे हमने छोड़ा था. हम वहीं से स्टार्ट करेंगे. सो आई वॉन्ट यू ऑल टू स्टार्ट आंसरिंग. ठीक है, आपको कैसे आंसर करना है, लेट मी टेल यू, यू हैव टू आंसर in like this question number and then you write your option. Okay, you can write A, you can write B, you can write C, you can write D. So I want the question number also. Okay, with this, so I can see 7 people watching. I want you to start answering so that we can do maximum questions. ठीक है, जितने questions करेंगे उतना अच्छा है आपके लिए. So question number 44. तो हम हैं, यस हम यहाँ पर हैं, राइट. हाई ग्रेड स्क्वैमस इंट्राएपिथेलियल लीजन्स. गुड मॉर्निंग मेडिको हिंदुस्तानी, गुड मॉर्निंग अक्षय. हाई ग्रेड स्क्वैमस इंट्राएपिथेलियल लीजन्स आर फाउंड ऑन पैप स्मेयर. नाउ व्हाट विल बी द नेक्स्ट स्टेप ऑफ मैनेजमेंट. हाई ग्रेड HSIL आया है पैप स्मेयर पे, अब आप क्या करेंगे? व्हाट विल बी द नेक्स्ट ऑप्शन? Will you do a colposcopic study and biopsy of the suspicious lesions? Will you do a hysterectomy straight away? Radiotherapy, liquid based cytology, या फिर आप HPV DNA टेस्टिंग करेंगे? So there are 2 options जिसमें आपको confusion होगा, I'm sure. ओके, आंसर्स प्लीज, डोंट टेक सो मच टाइम, आंसर दो. आंसर नहीं दोगे तो हम आगे नहीं बढ़ पाएंगे. वी हैव गुड नंबर ऑफ क्वेश्चंस हियर. Okay, 44A, we have one answer, focus on goal. I like the channel's name, focus on goal. Yes, अर्जुन की आँख. Okay, 44ADE, अक्षय आपके अकॉर्डिंग ADE है. Alright, 44A. तो बेसिकली द आंसर इज A. हिस्टेरेक्टमी क्यों करेंगे HSIL में? वाई विल यू डू अ हिस्टेरेक्टमी? वाई विल यू डू अ रेडियोथेरेपी? लिक्विड बेस्ड साइटोलॉजी क्यों करोगे? यू ऑलरेडी हैव अ पैप स्मेयर का रिपोर्ट ना, यू ऑलरेडी हैव द रिपोर्ट. अब कंफ्यूजन इसमें आता है और इसमें आता है. HPV DNA इसलिए नहीं करेंगे बिकॉज HSIL में एनीवे दिस इज गोइंग टू बी पॉजिटिव. Anyway, this is going to be positive because 90-95% cervical cancers are because of HPV. So what will you gain by doing HPV testing? राइट अगर ऑलरेडी HSIL आ गया तो अब तो आपको बायोप्सी करनी है बिकॉज CIN II, CIN III और कार्सिनोमा इन सिटू अगर ये इसमें से कुछ आ गया बायोप्सी में, देन यू विल हैव टू डू द ट्रीटमेंट. ठीक है. कोन बायोप्सी इज इंडिकेटेड इन ऑल ऑफ द फॉलोइंग एक्सेप्ट. क्वेश्चन नंबर 45. कोन बायोप्सी इज इंडिकेटेड इन ऑल ऑफ द फॉलोइंग एक्सेप्ट. Indefinite diagnosis on colposcopy, this is asking except. Most of them are true except for one. CIN III, cervical metaplasia, microinvasive carcinoma. Very simple question. Okay, waiting guys. Question number 45. इतना टाइम लगाओगे तो आगे कैसे बढ़ेंगे? कम ऑन, 10 people are watching. 2 लोग तो आंसर दो कम से कम. Okay, so we have one answer, RD. Anybody else? Kindly write the number of the question as well, 45. We have another answer, B. So B and C. So let me give you the answer. It is cervical metaplasia. Metaplasia is not abnormal. Metaplasia is simply when the TZ is changing. The transformations on the columnar cells changing into squamous, squamous changing into columnar. Okay, so this is not an indication for cone biopsy. Why will you do it? Otherwise, all are indications of cone biopsy in some way. Cone biopsy of the cervix is indicated in all. Now they are not asking except. Now they are asking indicated in all cases showing parametrial invasion, abnormal pap smear, endometrial carcinoma, endocervical curettage positive, and clear cell carcinoma. So it's a PGI question. You can have more than one option. So cone biopsy is indicated in all cases showing what? Quite a simple one. There's no confusion in it. Okay, so 46 BCE, we have one answer. Anyone else? You want to rethink RD, your options? There's something wrong in your options. Then we have another answer, BDA. So B, D and A, okay? B, D and A. You're saying A, B, D, right? You need to focus on goal. There's something wrong in your answer. Both of you are slightly right, slightly wrong. Anybody else wants to try? Hint is there are more than one options which are correct, okay? More than one option is correct. So it can be 2, it can be 3, it can be 4, it can be 5. Anybody else wants to try? Alright, so nobody's answering. Cone biopsy is indicated in abnormal PAP smear and endocervical curettage positive. That is when cone biopsy means you are doing a cone like this. Okay, so you're removing the ectocervix and you're removing the endocervical canal. So that is when the curettage is positive. B and D, yes, focus on goal. D is it's not E. Clear cell carcinoma is very, very invasive. You will not do a cone biopsy. You have to check if it's a clear-cut carcinoma. Why will you do a cone biopsy? You have to do a hysterectomy, okay, unless the patient is like having a squamous cell carcinoma in a very young patient and it's a micro-invasive stage 1A1, then you can think of cone biopsy. But otherwise, parametrial invasion means it has gone to stage 2B. This is a very invasive carcinoma. And endometrial carcinoma, why will you do a biopsy of the cervix? Cone biopsy, it is endometrial cancer is here. So you have to remove the uterus itself, hysterectomy. So it's only abnormal pap smear and endocervical curettage positive. Okay? So it's B and D. 47. True about LSIL lesions. Low grade LSIL lesions. What is true? They are confined to the lower 1/3 of the epithelium of the cervix. All cases are treated by cryo. 30% will progress to invasive cancer. It is kept under observation with pap smear of HP or HPV tests. Or, okay? What is your answer? Question number 47. Okay, question number 47. So that's Shodelna Sharpa, somebody new on my channel in my lecture. So are you answering question number 47? Please write down the number of the question. (47) we have one answer, D. Okay. Mind if this is a PGI question, and PGI will have more than one option. So hint is more than one option you have to choose. Okay. So you want to correct your answer. Focus on goal. Shodelna. Try and see what all other options can be available for you. So both of you have answered D. Would you like to add more options? That is a hint that there are more than one options here. So, waiting. D is correct, yes, and one more. Okay. Medico, you're saying A, C and D. No, it is only A. Because the cervical epithelium, we know that there is a basement membrane and then the entire epithelium with the basal cells and all those navicular cells and all that. Well, anyway, that is the vaginal cell. So this is the basically the epithelium of the cervix. This is the basement membrane. When the basement membrane is broken, it becomes invasive cancer. When the entire thickness is involved, it is CIN-2. When it is lower 1/3, it is CIN-1. Or CIN-2, then it is CIN-3. And this will be carcinoma in situ when the entire thickness will be involved. Okay, but the basement membrane is still intact. Okay, so it is A and D. Question number 48. A woman undergoes pap smear. Okay, they have not told you the age. Cytology is showing ascus. That is ascus. Next line of management will be what? Okay, after ascus, what will you do? They have not told you the age. So what can be the options? Again, a PGI question. So more than one options. That is a hint. Okay, question number 48. What do you do when it's an ASCUS report in any patient? Of course, it will depend upon the age, but just think what all can be the options. Say if she's young, less than 25, she's between 25 to 40, she's above 40. So you have to think of all those options. 48A, okay, and C. Somebody is saying A and D, okay. So we have A common, that is true. Yes, you will repeat a PAP smear because one ASCUS report you cannot jump into doing something invasive. Then what else? Then we have option C and D. One is saying C, one is saying D. Tell me. I will not do a leap on an ASCUS. Why will you do a leap on an ASCUS, a single report? So you repeat a PAP smear. You do HPV DNA testing. You can, especially if the patient is above 30. If she's above 30 years of age, that is the time, 30-35, when this HPV virus will start integrating with the cervical cells. It is a epitheliotropic virus. We know that. It lives within the cell, okay? It survives here and it gets integrated within the nucleus of the cell, and this is how it multiplies inside, okay? So after 30-35, the immunity of the patient, the lady, to clear this HPV from her system will be less. So if she's above 30, you do HPV DNA testing along with the PAP smear. This can be done together. And there is one more option. No biopsy is required. You have to do a colposcopy. If at all, this patient had ASCUS, and actually I'm not very happy with this option. They have actually chosen this option, but repeat PAP smear, and if she's above 30, then you can do an HPV testing. Actually, after getting 2 ASCUS reports, then you go for a colposcopy. But now they haven't told you actually exactly what to happen. So I would have suggested A and C, but they have actually chosen E also, colposcopy also. And as such, there is no explanation for this. If I see the explanation, they don't have an explanation, okay? So it is A, C and E. Therapeutic conization is indicated when? Therapeutic, question number 49. That's what I'm saying. It's normally after 2 ASCUS reports when you do a colposcopy. So I'm not very happy with the answer, but sometimes like you have to go with your common sense and whatever you have read, because when you are following 2-3 books and doing so many MCQs, there will be certain like 5% disparities arising in every exam, whether it's NEET PG, whether it's NEET, whether it's even MRCOG. When I did MRCOG, even then there were certain questions which were like answers all were bizarre. Not bizarre, but it was like one book is saying this, one book is saying this. Unless they have an explanation, fine. But we know that 2 ASCUS reports recommends colposcopy. So I would say you stick with A and C. I would not recommend E. Okay, but in your book, PGI question, the answer is A, C and E. Okay, so you have to use your own common sense now. Therapeutic conization is indicated in question number 49. Focus on goal, you have written 48. Question number 48, leap in a young patient. You will not do a leap in ASCUS, okay? So I would not go with that answer. Okay, 49, we have one answer, C. Unsatisfactory colposcopy with cervical dysplasia, therapeutic conization, okay? So basically you are not trying to diagnose, you are not treating it. So mind it, diagnostic and therapeutic are different. Diagnostic indications are different, therapeutic indications are different. So you want to reconsider your answer. Okay, yes, so I'll go with this answer, that is microinvasive carcinoma. Let me tell you the therapeutic indications of conization and the diagnostic indications of conization. The diagnostic ones will be when you cannot see the transformation zone. Okay, so the transformation zone has gone inside and it is type 3 transformation zone and you're suspecting something, then you do a conization, especially when the ECC, the endocervical curettage, has come back positive. Okay, so the squamous columnar junction is not seen. It is a type 3 TZ. Limits of the lesion cannot. You see a lesion. You can see a lesion here, but you cannot see where it is going up to. Then you do a conization. Then microinvasive carcinoma or adenoma carcinoma in situ is suspected. It is not diagnosed. Here it is therapeutic. So it will be treating it. Okay. So when it is suspected along with because the ECC came back positive, or the patient is high risk and she's giving you symptoms and the high risk factors have been calculated. So in suspicion, you do a diagnostic conisation. Lack of correlation between cytology, biopsy and colposcopy. You did a punch biopsy, you did a colposcopy, or you did a colposcopic directed biopsy, and the PAP smear, they're all different reports. Then you do a proper cone, remove it and send it for diagnosis. So when it comes to therapeutic, it is microinvasive carcinoma in a young patient or carcinoma in situ. Okay, so these are the two therapeutic indications of conisation. All right. Then a young patient comes with mild erosion of the cervix and PAP smear shows dysplasia. Next step is what? Young lady comes with mild erosion of the cervix and PAP smear. Okay, so they've told you young, mild erosion and PAP smear shows dysplasia. They haven't told you what kind of dysplasia. Now what will be the next step? Why have they added mild erosion? Just think about it. And they've told you she's young. Okay, question number 50. We have 10 more minutes. We can finish maybe 10 more questions or more than that. Okay, question number 50 you are answering. So Abu, you're saying A. Hina, you're saying B. Abu, you're okay, yeah, okay, same answer. Okay. Okay, so there's a confusion between antibiotics and colposcopy. We will go for antibiotic. That is why I gave you the hint. Why have they added erosion and why have they added a young lady? So young ladies, because they are sexually active, very active, and they can sometimes, and plus young, they will be delivering babies. So because of that, they might end up with erosions. They may be on OCPs, they may be pregnant, they may be because of the sexual activity, anything that can lead to erosion. It can be a simply infectious erosion which has caused eroding of the cervical epithelium, which has led to erosion. So that is the reason why they added erosion. So first you treat with antibiotics, then you see what is the dysplasia. The dysplasia might just go away, or it might become from high grade, it might become low grade. Okay, so we first give antibiotics. That was a hint. A 35-year-old lady with PCB, postcoital bleeding, management is what? She's 35. Okay, so she's at the age when you start thinking negatively, because obviously she's going towards a higher age. 30-35 is the borderline age. So question number 51, what will you do now? Postcoital bleeding, will you do a clinical examination and PAP smear, or you will do a visual examination with Lugol's iodine, this is known as villi, or you will do a visual inspection examination with acetic acid, VIA, or you will simply do a colposcopy? What will you do? Okay, question number 51, we have one answer, two answers. Okay, so we will go with another answer, sure, Elna. So everybody is like clinical examination and PAP smear. She's come to you for the first time. You won't jump into all these investigations. And these two are basically done for postmenopausal patients who are intolerant to speculum examination or prolonged colposcopic examination, or even in the rural areas when we cannot take a colposcope. Okay, so clinical examination and PAP smear will be the first thing to do. Focus on goal, according to you it is B. No, it is not required. Okay. 52. A 55-year-old presenting to outpatient department with PCB 3 months, and she has a 1 by 1 centimeter nodule. So you can see the lesion on the anterior lip. The most appropriate investigation to be done subsequently is what? She's 55. Okay. 3 months postcoital bleeding. One of the most common, very common symptoms of cervical cancer, postcoital bleeding. Okay, Hina, according to you it is punch biopsy. Anybody else? So we have everybody saying B. Abu, it is not PAP, it is punch. Now you can see the lesion, okay? You can see that there is a nodule here. So why do you just not remove it and send it for biopsy? No PAP smear, no colposcopy. Okay. Now, Meena, who is 53-year-old, 45 years old with postcoital bleeding again, and there is a friable mass. Okay, so the cervix shows a friable mass like a cauliflower. What will you do now? Next step of management will be colposcopic directed biopsy, 6-monthly PAP smear, punch biopsy, or only observation. I think a very simple answer. Very, very simple answer. Question number 53. Okay, you're not writing the answer question number, but I'm assuming it's 53. So A, everybody's saying A. Why will you do a colposcopy for such a big mass which is hanging? You already did a punch biopsy in the previous case when there was a small nodule. Now she has ended up with a big friable mass. Just do a punch biopsy. I told you cervical cancer can be easily, when it's a friable mass, you don't even need a biopsy instrument. You can just do a PV examination and you can scrape off with your fingers only. It is so friable, and they've told you it's not a nodule, it's a friable one. Okay, so it is 53D, it's not A. No colposcopic directed biopsy, it has to be a punch biopsy. Okay, everybody is saying A. Why waste time in colposcopy? Investigation of choice in a postcoital bleeding in a 60-year-old lady is what? She's 60, she's having postcoital bleeding. What will be the investigation of choice? PAP smear, colposcopy and biopsy, pelvic ultrasound, cone excision of the cervix. Tell me. Why you people are getting confused? See, she's a 60-year-old lady. 60-year-old mein TZ becomes type 3. So what is the type 3 TZ? Normally the cervix hangs like this. Okay, this is the external cervix that we see in a normal reproductive age group. When it comes to a postmenopausal woman, she will have a cervix like this, kind of flushed out. Okay, so this cervix will be so small, you won't be able to insert a speculum first of all in a 60-year-old, and this cervix will be so conical like this. How will you even do a PAP smear? The os will be absolutely closed and stenosed. So you will need a colposcopy and biopsy. Okay, yes, Nabeen, you are right, and focus on goal, you are also right. Everybody else is saying A. No role of PAP smear at the age of 60, especially when she's having postcoital bleeding. That is the age when the integration of the HPV has already been done, and it is very suspicious of cervical cancer. Around 30 to 35%, 30 to 50% early cancers are not diagnosed by PAP smear. Okay, so PAP smears in a patient, when you are putting a spatula, this needs a proper os, and the os is so flushed, this will not even enter. Okay, and the vagina itself is like, the entire fornix is absolutely gone, because the postmenopausal lady, the fornices are absolutely gone and the cervix is absolutely flushed with the vagina. Okay, yes, Mayur and Nabeen, you are right. Question number 55, 40-year-old, okay, not very old, not very young, abnormal cervical cytology, CIN III. So that's a high grade. Okay, the next best step is in the management would be, you will straight away do a hysterectomy, you will do colposcopy and LEEP, you will do colposcopy and cryo, or you will do conisation. Tell me. Question number 55. Yes, it is not Aya spatula, it is Ayer's spatula. Ayer's. Okay, that is the name of the PAP smear spatula. Ayer's spatula. (55B), 55D, 55B, maximum B, and that is right. It is colposcopy and biopsy. Why will you do a conisation? It is very difficult to do a conisation, and it is very tedious. It's very high morbidity also. So when the PAP smear is showing you CIN III, that is HSIL, then you need to make a proper colposcopic biopsy. So a LEEP is much preferred. as compared to conisation, because this is much less invasive. It has a heat element which stops bleeding, and the chances of hemorrhage and infection are much less. So the answer will be colposcopy. You check where the lesion is and do a biopsy and get a confirmation, okay, because PAP is just screening method. Then 56, the question number 56, the lady is 35 years old. She's a para 3 with CIN III, again HSIL, on colposcopic biopsy. So now the biopsy has been done, it has been diagnosed. The biopsy finding is HSIL, okay. CIN III, what would you do now? So the biopsy is CIN III, 35-year-old. You will do a leap, you will do conisation, you will do hysterectomy, or you will do cryotherapy. Very simple, because I just told you the answer in the previous question. What is the preferred treatment? So I think that should be the last question, because we have done 32 minutes. Or maybe one more question, because we started late. 56. Okay, we have A, we have B. A and B, and what else? Anybody wants to try? Okay, so it is A, leap, because that is the best option when you have a young lady who's para 3. She may not be wanting any more children, but you will not straight away go for conisation or hysterectomy. Cryo is not of much use, so it is leap. Okay, last question. Which of the following statements is not true about cervical cancer screening guidelines according to the WHO? Okay, last question, guys. PAP smear should be repeated yearly in a woman of reproductive age group. HPV should be done 5 yearly in women between 30 to 49. VIA, that is visual inspection with acetic acid, is more reliable at older age, as it becomes easier to identify the transformation zone with age. Then PAP smear can be repeated less frequently if it comes out negative for 3 consecutive years. So what is not true in this? Question number 57, last question for today. I know it's too much to read, but I have just highlighted the main things. They are saying yearly, then it is 5 yearly. Age is this, and VIA, they are saying it is more reliable at older age because it becomes easier to identify the TZ with age, and PAP smear can be repeated less frequently. So there should be something in all the 4 options which has made it wrong. So focus on goal. 57B, then 57D. Okay, so the answer is A, because it is not done yearly, it is 3 yearly. Any screening does not tell you that you have to do it yearly, unless she is a follow-up patient of CIN III or a follow-up patient of carcinoma in situ, and you have done a conisation or a leap, then you follow her up yearly. Okay, so HPV testing 5 yearly, yes. If you combine PAP along with the HPV testing, then you can skip the 3 yearly screening and you can make it 5 yearly. Okay, similarly this answer is also true. PAP smear can be repeated less frequently if it comes out negative for 3 consecutive years. Okay, so probably what they mean is, in the screening guidelines, when you are following up a patient of CA cervix or maybe carcinoma in situ or HSIL treated conservatively, then if all the 3 last findings were true, then you can again go back to the 3 yearly screening. This is what they meant, and this is also true because in a lady an old age, you put a speculum and you try to do a colposcopy, it is very difficult. Simply just put a speculum and put the acetic acid, and then probably you'll be able to identify the TZ well. So the answer, this one, repeated yearly, is wrong. In the women of reproductive age, you just do it 3 yearly. Alright, so thank you guys. We'll see you in the evening at 7 PM on the special class platform, that is Unacademy Learners app, and you have to use my code Dr. Sonal to unlock it. Okay, DRSONAL to unlock it, and we will quickly do vulval and vaginal cancer. Alright, bye bye and take care.